Our Dr. Tara Narula is here now to talk about the health behind this. Doctor, 52 years old, Luke Perry was. Is that uncommon? Is that extraordinary?
So I think one of the misconceptions is that strokes are a disease of the elderly. But what I want to convey is that this can happen to anyone at any age. And while we know that the risk of stroke does increase if you're over 65, right? 3/4 of strokes happen in populations over 65. The risk doubles every 10 years over the age of 55. There's still a fair percentage of people who have strokes in their younger ages. We also have seen an increase in the incidence of strokes in a younger population. Now, whether that's because we're diagnosing them more often or because there's an increase in risk factors, things like high blood pressure and obesity and diabetes that's driving it, it's really unclear. But the big message to young people is, look, you need to understand that you're at risk, understand what your risk factors are, and importantly, recognize symptoms, because time is brain. Every minute that goes by in a large stroke, you lose 2 million brain cells, and this damage is irreversible. And so, it's very important to act on symptoms, even if you think they go away, even if you think they're not a big deal, you need to get to the hospital, because our treatments require intervention in a short window of time.
Symptoms like what?
Symptoms like numbness or tingling in an arm or leg, inability to see well, or confusion, or trouble walking, or difficulty with your speech, or facial droop, lack of coordination, massive headache, any of those things.
And 80% of strokes are preventable.
Yes,
Stop smoking.
Exactly. So controlling blood pressure, which is very important, stopping smoking, controlling your weight, diet, exercise, all of the same things we talk about for heart disease.
Thank you.
Thank you very much, Tara. It was very surprising, though, to get that news yesterday. Thank you. Two young sisters who